Hi, it's Dr. Tracy again. I want to talk about euthanasia and the actual process. I know it's not a topic most people want to hear, but it is a topic that I have a lot of questions on. Basically, people want to know what happens when a vet comes to my home or if I bring my pet in for euthanasia. So I'm going to talk to you more about from a perspective if you have somebody come to your home and do the home euthanasia. I'll also touch up a little bit on things to request if you're doing this at an actual veterinary hospital as well. If you are not sure if there's somebody that comes to your home in your area, I recommend going on to inhomepeteuthanasia.com. They're an actual home directory that you can look up your state and see if there's somebody in your area and then contact them and see if they service your city. So most people want to know what's going to happen when I come to their home. If you haven't taken care of paperwork and payment ahead of time, most of the time when the doctor gets there, we'll get that out of the way right away. Nobody wants to deal with that and or can think clearly enough to have to deal with that afterwards. Once that is all taken care of and when you're ready, the veterinarian is going to walk you through the process. Now, most veterinarians want to stay out of the way as best we can. You, at least with our company, are allowed to hug, hold, be right there, and we just kind of move in and out as need be. We'll usually set off out to the side and get everything set up while you're taking care of your pet and getting ready. It is a no holds bar, so I tell people bring whatever treats you want. If they're eating, if they're not vomiting, feed whatever you want. Give pain medications as normal that day. Nothing you're going to do is going to interfere with anything that we do. Once you and your family are ready, the first thing we will do is give your pet a shot. That first shot is generally, for most places, a sedative, a muscle relaxer, and a really strong pain medication all together in one. As far as pain, that shot's not much different than if they were to go to the vet clinic and get a shot for a rabies vaccine. However, in the home, we can't explain to your pet that we're giving them a vaccine, and very few pets get shots in their home. So it can be a little shocking, especially to cats, to get this shot. Some animals will react for a minute, but most of them get over it pretty quickly. I personally, if they're still eating, will bring a really special treat like a cheeseburger and try to feed them that as a distraction. And my hopes is that they're so excited about the food that we're feeding them that they don't notice the shot, or my hopes is that they go right back to eating after we give the shot and kind of get over it quickly. So that first shot for most pets is going to put them into a nice deep sleep within about 5 to 10 minutes. Some animals are a little quicker, some are a little slower. I always tell clients that there's the books, and unfortunately most animals don't read the books and they throw them out the window, especially cats, and they do whatever they please, and we just to adjust and allow them to do whatever they want. However, most pets are asleep within that 5 to 10 minute window. Now for our company, we are looking for a very deep, relaxed sleep. We don't want any more pain, any more anxiety. We want them basically in a moderate anesthesia level. Once they are asleep, we will tuck some potty pads underneath them. Some animals will relax to the point where they could let go of a little urine, or some will even have diarrhea just because of the stress of what's been going on with whatever disease they're dealing with, or also the extra special treats that they've been getting the days before if they were still eating. I also like to let owners know that almost all of our pets, especially cats, will fall asleep and pass with their eyes somewhat open. It can be very upsetting for people if they're not prepared for that. So I do like you to know that ahead of time, especially if there's kids, because we'll say they're asleep and their eyes are wide open and kids are looking at you going, I don't think that they're asleep. They may still blink on occasion after that first shot, but it should be really slow and sluggish. Honestly, for our cats and most of our small dogs, they completely lose that little blink reflex when you touch and pet around them. Once your pet is fully asleep, the doctor will come and check them and make sure they are very comfortable. Usually they'll do kind of a little pet around the eyes and make sure that that's slow and sluggish. I always give a little tickle to the ear to make sure that little ear reflex or a dog doesn't shake its head because they're still feeling that. And then lastly, because most of our animals hate their feet being touched, I sit there and I tickle their toes and I actually give it a pretty good pinch. We're making sure that that deep pain is gone and that that pet is in that really good deep anesthesia. Now at the the vet office, some vets do not sedate. They'll bring your pet in back and they'll place an IV catheter in their leg with a technician helping to hold, and then they'll bring the pet back into the room. Now, please know that you have the right to request a sedative being given prior to that IV catheter being placed. It probably will mean an extra expense at the vet clinic, but I think it's far worth it. Yes, your pet is going to be in a very deep sleep and they're not going to be responsive to much, but at the same point, it's also taking away that anxiety and that pain of being taken away from their owners and also of having an IV placed. A lot of vet clinics nowadays, and when I worked at the vet clinic, I actually did everything in the room right in front of the owner, which is something you can ask. I'm not sure that every vet clinic will allow it, but it is certainly something that you can ask as well, which might help ease some of your pet's anxiety too. Now I'm using Gus as an example again, but this is something that's good to show kids. Next, what the vet will do is place a little tourniquet on their leg and they'll actually shave a little spot of hair to make sure they can see the vein better. Now, as you can see, I don't have this very tight, but neither the tourniquet nor the shaving hurt. However, if your pet wasn't asleep, they'd pull back their leg like Gus is doing or even turn and give it a dirty look. If they react to it, we should stop and wait and give them more time. This allows the vet to have some blood pressure so they can place an IV in that vein that's sitting there. So I took the tourniquet off because Gus was freaking out about it. However, this is what it's going to look like when your vet places an IV. And it's a good thing to show that to kids too. Basically, all it is a little plastic tube that goes into the vein. And then this is just a little plug. So I like to tell kids that if you're seeing any needles poking your dog, it's just poking this little plastic piece. Most kids seem to accept that. Now, when the vet is placing the IV, sometimes there can be a little flash of blood. So I usually try to cover it up or have the kids look away or step away for this part. Also, with the sedated animal, a lot of times they're already sick and their blood pressure is pretty bad. Then we sedate them and make their blood pressure even worse. So many times it can be a little difficult for a vet to find a good vein to place an IV. Either way, make sure that you know that your pet is, and your kids know that your pet is very comfortable and they're not feeling this, just in case the vet has to try multiple ways of getting that IV in or different legs to try to get a good vein. Now, after the IV is placed and once the family is ready, we will give that last medicine. That last medicine is either pentobarbital or usually Fatal Plus. They're both medications that are going to put your pet into an even deeper sleep and help them to pass more peacefully. They're usually an odd color, like a bright blue, a brown, or even a bright pink color. A lot of kids don't want to see that, so I actually will put a towel over it and give it underneath the towel so nobody has to see that. But a lot of clients will ask, what am I going to see? And I like people to know what they may see as their pet passes away so they can focus on being there for their pet and not focus on what their pet is doing. And at the same point, kids need to know that their pet is very comfortable and everything they're doing is normal passing and it's nothing to be scared about. So the first thing I like clients to know is that this last part goes very quickly. So usually by the time we're done giving that last medicine or a minute or so afterwards, their pet has already passed. They need to prepare for that. Almost every client, even though I tell them that, turn to me and say, oh my gosh, that was really quick. And it is really quick. So you want to be prepared for that part and have your time to say goodbye before your vet gives that. Some pets, as they pass, they'll just stop breathing and that's all we'll see. A lot of pets look like they stop breathing and then about 10 or 15 seconds later, they'll start taking some very deep panting breaths. All that is the deepest of sleep, nothing more. Some animals will stretch out their legs or they'll flex them in right as they go, which is just a muscle reflex. And some pets actually can do what's called reflexive breaths after they pass. And it can be right as they're passing or minutes after they'll pass. They'll actually take a big type breath like that. It'll make everybody jump. It looks really dramatic, unfortunately. And it actually looks like the animal is gasping. All it is I like to explain it as basically a hiccup of that diaphragm. That muscle sometimes figures it out a little later, and they could do multiples or just one or two. But either way, their pet's not feeling that. It's all end stage passing. And many times after pets do that, it's usually after their heart's already stopped. So it is a normal reflex. Other things people and kids especially should know that they can see afterwards. Sometimes, especially cats, you'll see the little hair on their tail kind of expand out and stay puffy. And then also at the same point, sometimes we can see little muscle twitches or nerve twitches, especially around the nose or face. And sometimes if pets were really tense before they pass, you can see it along those big muscles of the spine or even sometimes in the legs. Now, the one thing I want to tell people is people panic and say, what happens if you can't find an IV and place a catheter because my dog's too sick or too dehydrated to get an IV in? That's okay. The last medicine can be given a different way. Your vet is going to make sure that your pet is in the deepest of deep sleep before they would do this. But with small dogs and with cats, many times this is the way we do it because I kind of find it insulting, especially for a cat, to shave leg after leg after leg trying to find a good vein. Most of the times their veins are really fragile because they're really old and they're really sick and severely dehydrated. So finding a good vein can be really hard. So instead we actually can give the last medicine into their tummy under a blanket. Pets will tend to pass a little slower. So for us, we need to know it might take a little more time for them to absorb that medicine and pass away. However, for them, because we will assure they're in that really good deep anesthesia, it's not going to matter. They're not going to know the difference. Now, after your pet has passed, personally, I will take out any IV catheter and try to get rid of any doctory stuff, especially when there's kids around, so it's not as scary. If your pet has soiled themselves, usually we'll change out the pads to try to keep them nice and clean. And then usually we'll step away from your pet and give you some time to grieve. We certainly can step out of the room, or we can just back off and start working on anything that you guys want for mementos, whether it be hair clippings or a clay paw print, etc. Either way, we'll give you the time you need with your pet afterwards. And then when you're ready, I will personally bring all of my stuff out to the car. And then if it's a large animal, I'll come in with a stretcher. If it's a medium animal, usually we'll just have a really nice blanket for them. And if it's a small animal, I have a little basket that I'll bring in and we'll place them in that as long as we're taking them with us, and we'll get them out to the car and take good care of them and get them to the crematory from there. Now, depending on what crematory you're using and what kind of cremation you want, most pets are usually returned back to the family within 2 weeks. There is also a communal cremation where you don't receive any ashes back, and many people want to do that. There is no right or wrong decision when it comes to cremation. There are also families that check regulations in their state and their city and bury on property too. I hope this helps to answer some of those questions and helps your family to be more prepared about the actual process of euthanasia. Please don't hesitate to reach out if you have any questions regarding this topic.